Are you having trouble getting enough milk when you pump for your baby? Well, if you have questions about that, join me for today's episode of Breastfeeding Matters. So, yesterday I got the following question over on my Facebook page. The question goes like this: if I pump, about how much milk is normal to collect in one session? With my first, I could use a hand pump and get about 4 ounces per side. Now, using an electric pump, I can barely get 2 ounces total if I'm lucky. It makes me wonder if I really know how to use an electric pump. Would it be odd for me to go to the lactation consultant at the hospital with the pump and have her watch me use it to make sure I'm doing it right? Well, first of all, I'm going to say that it is never odd to ask for help from the closest IBCLC. That's what we are here for. We've spent a lot of time studying and learning just exactly for this so we can help moms breastfeed, and that's our passion. So please never feel badly about getting that help. The easy answer, not the right answer necessarily, but the easy answer that is something I'm sure you've heard a lot of times is, oh, don't worry about it. Not everyone lets down for a pump. You can't gauge how much milk you produce by what you get from the pump, etc., etc., etc. And for what it's worth, that's actually very true, but it's really not very helpful. So when it comes to pumping, if you're not getting the amount you expect to from the pump, there are a few things we need to consider. There are basically 3 issues. And you could be dealing with more than one of these issues at once, which is why working with an IBCLC can be helpful. The first issue is your pump. Is it the right pump? Is it working properly? Does it fit properly? Basically all the pump troubleshooting type stuff. The second issue is your supply. Are you having issues with your supply? Are there things we can do to help improve your supply? And the last issue is your personal letdown to the pump. If the pump is working correctly and your supply is well managed, what can we do to make it easier for you to get let down from the pump? So right now, today, we're going to look at the first issue, your pump. First of all, do you have the right pump? I think every IBCLC has a favorite pump. And I think most IBCLCs, but not all, have the same favorite pump, and that's the Medela Pump and Style. There are other really good pumps out there. I prefer anything by Medela, but some people really like the Amita breast pumps. There are a lot of pumps at the grocery store, Walmart, the drugstore, so on, that frankly are not worth the money they cost. The worst part is that they still aren't cheap. But moms buy them because they don't have enough money for the Medela. I get it, but when you've paid $50 to $100 for a breast pump that doesn't do the job, that's money wasted. Even worse, moms think that the problem is them and get discouraged. What works the best for most moms is an automatic double pump that generates about 40 to 60 suction and release cycles per minute. Now, like I said, to a certain extent, you get what you pay for with a breast pump. In the United States, with the Affordable Care Act, you should be entitled to either a Medela or an Amita breast pump from your insurance, so please make sure that you ask about that. So let's do some troubleshooting of the Medela Pump and Style because that's one of the most common pumps that I see in use. We need to ask, is your pump put together properly? The parts of the pump that you place on your breast, it consists of 4 parts: the membrane, the valve, the connector, and the breast shield. Now, you would be amazed just how important that little white membrane is. If it isn't on correctly, if it's torn, or if it's worn out, the pump simply will not function properly. A lot of moms think that their milk supply is dwindling, and really, they just need to replace the membranes on their pump. The membrane snaps into the yellow valve. You want to make sure that the membrane is snapped into the valve properly and that when you look at it, the membrane is lying flat against the valve. If the membrane is warped or worn out and not lying properly, it's time to replace it. They aren't expensive. Moms who pump during full-time employment for an exclusively breastfed baby often find they get the best results if they replace the membranes once a month. Okay, so now the valve, that then snaps on over the ring in the base of the connector. The last part that needs some close attention is the breast shield. A lot of women don't realize that it comes in different sizes. The Medela pump-in style comes with 24 millimeter size shields. However, the shields also come in one size smaller, 21 millimeters, and three increasingly larger sizes, 27 millimeters, 30 millimeters, and 36 millimeters. So how do you know if you have the right size breast shield? First of all, it does not matter how big your breast is. An A cup and a triple E cup might need the exact same size breast shield. The size is based entirely upon your nipple size. So when you place the shield on your breast, the nipple sticks into that longer, narrower tube of the pump opening. The breast shield is too big if more than about 1/4 inch of the areola, the dark tissue around the nipple, is drawn into the narrower tube. And you can get soreness and discomfort from having that rub up against the sides of the tube. The breast shield is too small if your nipple rubs along the sides of the narrower tube, and that will definitely cause discomfort and poor milk flow. Other things that are going to tell you that your breast shield is the wrong size is if the nipple or areola turns white when you're pumping, if you see redness, or if you can feel that you have unexpressed milk after each pumping. Also, please be aware you might need different size shields for each breast. You might need a different breast shield after you've been using the pump for a few months, or after different pregnancies and births. And what looks like it's right when the suction is off might be very not right when the suction is applied. Other issues you need to consider. Make sure that the tubing for the pump is firmly fitted at both the connector side and the pump side. If you are only pumping one side at a time, make sure to use the little yellow plug to block off the other side so that you don't have decreased suction. I have also run into the situation where that plug started to come out of the center where it's held in place, and that decreased the suction as well. So just kind of take a look at that. If you're using the battery pack or the car charger and you're having poor results, try plugging it directly into the current in your house and see if that works better for you. Make sure that the breast shield is lying evenly around the breast. You don't want it to have any air leaks, but you also don't want to push too hard up into the breast either. You could potentially block off the milk ducts, and that's very counterproductive. And the last important how to use the pump properly tip is please don't turn the suction up too high. A lot of women think they need to tough it out with the highest possible suction, hoping that that'll make the pump suck out more milk. But the pain that causes will actually inhibit milk flow. You want to find the setting that is truly comfortable and effective for you. And that might require a little playing around to determine. Some mothers actually pump the most milk when they have the suction down near the minimum setting. If you have any questions about pumps that I didn't cover here, please feel free to ask them in the comment section below. If I'm working, it might take me a little time to respond, but I will respond, I promise. Also, don't forget to subscribe so you get notified about the next 2 presentations on this topic, how to ensure that you have a good milk supply, and how to get the best letdown and expression you can from the pump. Have a wonderful, blessed day and enjoy your little one.